leaving 2 mm of bone, then this burst comes, the 1 and 2. So these cutting diamond bursts, they shave the whatever remaining bone of 1.5 or 2 mm bone you have left. They shave that area. Example, this is exposing only the 2 mm. Now you still want, this is now 6 mm. So you place that stopper and slowly in implant mode it goes into the osteotomy site and it shaves. So here you are not tapping, so that's the reason it has to be removed. Then the balloon comes and it goes and inflates and lifts the sinus. That's the technique. So once the depth is achieved and entire bone is removed, now example you want, this is 3.8 last, what we get 3.6 and 3.8. If you are placing a wider diameter implant, now this is a lateral cutting burr, end is smooth. So what happens if this is the floor, it is going and locks like this, and on the laterally you move in the osteotomy side. So gradually you widen it. So by doing so, you are not touching the lining also, then slowly you are whitening it. So that's for indirect sinus lift. Then for direct sinus lift, you have these diamond burrs, dome shaped diamond burrs, round burrs. This is, they shave it completely from the lateral window. In this one, we don't have that island of bone left because you are completely shaving it out. That's one drawback of this burr. Okay. So the advantage is it is running at very low RPM and slowly removing the bone layer by layer. So the moment you see it is coming very close to the lining, you can slowly wait and then start using your other instruments. Then you have trephine to make a window. The problem is sinus is never flat like this. You can have uneven thickness of bone. You try to use this, it would have perforated on one side already rather than removing also. So don't try to use this in the sinus window. Then these are curettes, sinus lift curettes. This one is a depth gauge probe for indirect sinus lift when you do, and it goes into the osteotomy site to check whether actually the bone is removed or still it is intact. And also you get to know the graduations. Okay. Now, these are different shapes curettes so that you can access to the all the 360 degrees angle of your sinus. Like example, if patient is sitting like this and a window is made right side. So with this angle, I can go posteriorly, inferiorly and some amount of superior bone. I cannot come this side because it is preventing. So for that side, this angle comes. Okay. This one gives angle, but the length is not there. Okay. So once we make a window, we use this curette first initially to detach the lining 360 degrees. We cannot go much depth with this one. We can only go depth with this one and with this one. For example, window is there like this. This will go inside like this depth and lift. Like this and lift. Push it on the medial side. But the problem is this tip is very small. There are some other kits which have broader working tip. What happens is larger the working tip, the less chances of tearing is there. A small tip, it would have folded up like this and it will tear. That's one drawback. Okay. Now we get these kit clone versions of these kits. So they are much cheaper. This was I think 65 or 80,000 something. Now you will get for 11,000 to 12,000 also. Same kit, same thing, entire thing. Book box size is also small.